Section 1 lays the foundation for what you'll learn in the PADI Rescue Diver course. It looks at what causes divers to get in trouble and what you need to consider before trying to help someone. You'll learn about types of stress, how they contribute to dive accidents, and what to do about them. Next, you'll get the basics on first aid kits and oxygen systems, followed by an overview of your possible roles at an accident scene. This section includes the principles and skills you'll practice, including self-rescue and aiding tired and panicked divers. The first step in preventing and handling dive emergencies is understanding what causes them. An emergency can arise on a well-planned, properly executed dive with properly qualified divers due to undiagnosed medical conditions, sudden environmental changes, or other unanticipated variables. Human error can be a factor. The main reason divers end up needing help is poor judgment, making bad decisions and intentionally violating accepted dive safety practices. These choices often seem reasonable and trivial at the time, but dive accident data suggest that they can have unfortunate consequences. As your situational awareness grows, you'll start noticing poor judgment in others. While you're not responsible for other divers' bad decisions or their consequences, you can tactfully ask questions and offer alternatives that lead to better choices. And if someone still violates safe dive practices, at least by being aware, you can try to mentally prepare to deal with what may result if you're in a position to do so. Good judgment avoids accidents, and you need it before a rescue, too. When an emergency arises, first, consider if you can assist from a safe place without entering the water. Second, if you must go in the water, consider whether you have the right equipment and the ability, given the situation, to perform the rescue. Third, consider whether you can expect to perform the rescue without getting in trouble yourself. When an emergency arises, stop and think a moment. Then respond. Diver emergencies involve stress, a mental and/or physical tension that causes emotional, mental, and physical changes. How it affects someone depends upon how extreme it is and how the diver deals with it. Physical stress can result from seasickness, overheating, overexertion, illness, injury, improper gear, and other influences that are beyond the diver's physical ability to cope. Physical stress doesn't have to be a problem if you exercise good judgment and apply a reasonable solution before the situation becomes serious. But it can also be one source of psychological stress. That is, stress caused by fear of a perceived threat, like fighting a current. Perceived threats may be real, imagined, or tied to beliefs, such as feeling pressured to dive in poor conditions due to the money or time it took to get to the site, or peer pressure, or both. Task loading is another cause of psychological stress, which is why you learn dive first, situation second, and communicate third in the PADI Advanced Open Water Diver course. Psychological stress can arise from anything a diver perceives to be beyond his ability to cope and lead to physical responses, including increased breathing and heart rate. This can lead to the symptoms of overexertion and air starvation in an unaware diver. When a diver perceives a problem, real or imagined, stress results with its physical and psychological responses. If the diver recognizes the cause and responds by reducing activity, controlling breathing, and expanding their thinking, then it has a positive response. If the diver doesn't recognize the stress or responds ineffectively, Anxiety rises, accompanied by the body's physical responses. These contribute to the stress and add to the cycle. Further events may reinforce the fear and raise stress even more, contributing to the cycle. If this cycle goes unchecked, stress may continue to rise. Mounting stress or a new problem cropping up may overwhelm the diver, resulting in uncontrolled instinctive behavior. The diver may experience perceptual narrowing and fixate on a single ineffective solution while overlooking obvious ones. This irrational instinctive release is panic, which is most typically active, like this, or less commonly, passive, when the victim essentially freezes into a trance-like state. But if the diver stops, thinks, and then applies his training to problem solving, he avoids perceptual narrowing, stays in control, and arrives at an alternative solution. The tendency to panic depends on how much threat and how much control over the threat a person perceives. Training, staying within experience limits, and personal disposition are the major factors in avoiding panic. Now let's look at some of the emergency-specific equipment you'll use in the PADI Rescue Diver course, starting with first aid kits. You're already familiar with these from your emergency first response training. As a rescue diver, plan to have a well-stocked first aid kit on hand when you dive. It's recommended that your kit include a rescue breathing mask. Rescue breathing masks reduce infection risk and simplify making a good seal when providing rescue breaths. As you'll practice, a rescue breathing mask is an effective way to provide rescue breaths in the water, and you can use one with an emergency oxygen system to provide oxygenated rescue breaths. Research suggests that administering oxygen is one of the most important first aid steps for a diver with suspected decompression sickness or lung overexpansion injuries. This makes it important to have emergency oxygen systems available when diving. You'll practice the basics for supplying emergency oxygen to breathing and non-breathing divers. This includes using non-resuscitator demand valve units for breathing divers. These function much like your scuba regulator's demand valve, but with 100% oxygen. For non-breathing divers, or those breathing very weakly, you use free-flow oxygen with a non-rebreather mask. This doesn't deliver 100% oxygen, and it's more wasteful, but it's the main option for those not breathing or with little breathing strength. Non-resuscitator demand valve and free flow are the systems primarily recommended for rescue divers. But with additional specialty training, some types of manually triggered resuscitator units, sometimes called positive pressure systems, are suited to lay rescuers. The PADI Emergency Oxygen Provider course provides this training, as well as additional details about providing emergency oxygen. Ask your instructor to learn more about the Emergency Oxygen Provider course. Automated external defibrillators, or AEDs, are devices that analyze a heartbeat and deliver a shock in an attempt to restore a normal heartbeat in cases of cardiac arrest. In your emergency first response course, you learned that the benefit of an AED is to increase the chances for survival by allowing a rescuer to attempt to restart the heart sooner than waiting for EMS personnel to arrive. Depending upon availability and local restrictions, if any, your instructor may include AED practice with your rescue diver training. When an emergency arises, your skills with accident management can help increase the likelihood of a positive outcome. To start, let's define victim and patient. A victim is someone who needs to be rescued or who is being helped but is not yet in a secure environment. A patient is someone receiving emergency medical care in a secure environment. An unresponsive diver in the water is a victim. Receiving first aid and CPR out of the water, the same diver is a patient. Your role in managing an emergency will depend upon the circumstances. If you're the most trained and qualified diver, chances are you'll take charge and direct the effort. With a more qualified diver, like a dive master present, you'll probably function as a skilled assistant. Either way, two forms of readiness prepare you. Personal readiness means being physically and mentally prepared by taking care of yourself and maintaining your skills. Equipment readiness means having and maintaining the tools for handling an emergency and knowing where they are. If an emergency arises, the first step is to assess the situation. Stop, breathe, think, then act. Who's involved? Who can help? What resources do you have? Every emergency is unique. Whatever helps and gets the job done, works. You continue to assess as the situation unfolds. Now, act on your plan. Take charge if no one else does, and take action in a calm, considered manner. If you're managing the situation, delegate. Have others assist within their qualifications. Even those with less training or non-divers can assist by fetching equipment, contacting emergency care, and so on. Once out of the water, attend to injuries, if any. Assure first aid, basic life support, emergency oxygen, or other aid as appropriate for the situation. Depending upon the situation, contact the local emergency medical system and DAN, the Divers Alert Network, or other local diver emergency system. As care progresses, you may have to control the scene to continue emergency care and coordinate with emergency medical personnel. The PADI Accident Management Work Slate provides places to list information that may help EMS, particularly with a suspected pressure-related dive injury. In a serious accident, you may need to arrange evacuation to medical care by coordinating with local EMS and diver emergency services to get to the closest available medical facility. EMS and the diver emergency service may then transfer the patient to a recompression chamber, if necessary. In an emergency, a local emergency assistance plan provides contact information for local emergency medical services, police, Coast Guard, or other appropriate services. Also, list the emergency number for the appropriate local diver emergency service. One or two numbers may cover areas with developed emergency systems, whereas for remote destinations you may need several, plus radio frequencies. Your instructor will explain what contact information applies to your area. How you respond to a diver emergency depends on the situation. But they all start with keeping yourself out of trouble and taking appropriate action if you have a problem. You can't help anyone if you are in trouble. We touched on preparation earlier, and there are 3 things you can do to help your self-rescue abilities. First, stay physically prepared by staying fit and healthy. Second, stay mentally prepared by diving confidently within your limits, by keeping your skills sharp, and by continuing to learn. Third, keep your equipment prepared by caring for your gear properly and having the emergency accessories you're supposed to have. Periodically, practice self-rescue skills like dealing with cramps, sharing air, and regaining your orientation. As you recall from the open water diver course, you prevent most equipment problems not only by maintaining it properly, but by inspecting it before each dive. Anticipate problems during dive planning and risk assessment, and plan how to avoid and handle them. And major accidents usually result from a chain of events that start small. So, if you see a problem occurring or about to, act early and break the chain. This reduces that risk that something small escalates into a disaster. If you have a problem, as you learned in the Advanced Open Water Diver course, maintain your situational awareness. Dive first, situation second, communicate third. Stop, breathe, Think and then act. Make a habit of visualizing possible problems and how to handle them. Mentally rehearsing proper responses has been shown to help people make good choices effectively. It's often obvious when a diver needs help, but not always, because equipment and distance can mask the more subtle signs, and a victim may not ask for help. Watch for signaling for help. Struggling at or below the surface, high treading, rejecting the mask and regulator, and climbing onto anything available to escape the water. Consider a motionless diver unresponsive and in need of help until you determine otherwise. You'll learn about helping unresponsive divers later in the course. A tired diver is a diver with a problem, but who is in control. Although we call this victim a tired diver, the actual problem may be cramps, injury, or a problem other than exhaustion. Regardless, the tired diver is managing stress effectively and, depending upon the situation, will often recover quickly and no longer need help. A panicked diver has lost control and abandoned his training in rational action. He may become fixated on a single ineffective solution and continue to struggle until rescued or exhausted. Handling a panicked diver is one of the most hazardous situations for the rescuer because the victim may climb with great strength onto anything, including you, to get out of the water. Because of this, you'll learn techniques for maintaining physical control while assisting panicked divers. Remember to constantly assess the victim because a tired diver can panic suddenly as you move in to help. As you've learned, when someone needs help, your first priority is you. This isn't just for your benefit, but for the victim's sake as well. You can't help if you're in trouble. So think about the most effective way to help while keeping yourself reasonably safe. This means if you're out of the water, getting in should be your last option. You'll practice non-swimming assists, which should be your first option. The simplest is to reach to the victim. Lie down, spread your legs for stability, and reach out with one hand. Use this position so you can't be pulled in yourself. Even better, extend something. You can reach farther, and if you do start to get pulled in, let go. If the victim is beyond reach, throw flotation and a line. Try to throw beyond the victim and then pull it to him. In a pinch, throw anything with reasonable buoyancy, and without a line if you must, because it may solve the immediate problem while you find another way to reach the victim. If the victim is too far to reach and you have nothing to throw, and you are near shore, you may be able to use a wading assist. Wade in no deeper than chest depth and extend something. If the water is dangerously cold, don't try this unless you're wearing appropriate exposure protection. If you can't reach, throw, or wade to the victim, your next option is to use a boat or other reasonably stable watercraft. Approach from downwind so the boat doesn't blow over the victim, and use a reach assist to pull her to the watercraft. When a non-swimming assist isn't possible, or you're already in the water, you'll use a swimming assist. Let's look at the steps, beginning with how to help tired divers. Swim to the victim with your face out of the water so you don't lose track of him. Pace your swim to be fast, but conserve energy to handle the assist and help tow him to safety. Stop near, but out of reach. Evaluate his mental state to be sure he's not panicked. If he's not buoyant, tell him to inflate his BCD or drop his weights. And note where his BCD inflator is in case you have to do it for him. Even though the diver hasn't panicked, have ample buoyancy just in case that changes. Make contact while reassuring him. If the diver hasn't been able to establish buoyancy, provide support and inflate the victim's BC. Drop his weights or both as necessary. Make direct eye contact as you reassure the diver. If conditions allow and it would help, have him take his mask off, lie back, and relax. Help the tired diver reach safety with a tow. Let the diver do as much for himself as possible. In most tired diver rescues, other than dropping weights to establish buoyancy, discarding equipment is a low priority. But sometimes removing equipment makes it easier for the victim to get out of the water, or may help if you have a long swim before exiting. Approach and evaluate a panicked diver exactly the same as a tired diver. Stop and evaluate the diver's state of mind. Tell him to inflate his BCD or drop his weights, and note where his BCD inflator is. Chances are the diver won't respond to your directions. Assess the diver's strength and size compared to your own to determine whether to approach on the surface or underwater. A surface approach is fastest, but potentially riskier for you. Depending upon the situation, it may be best to first inflate your BCD so you won't get pushed under if the victim climbs on you. Use your regulator, unless you're very low on gas. Swim around behind the panicked victim, staying beyond reach. Drop the victim's weights, or inflate his BCD, or both. Grab the victim's cylinder valve and knee cradle it, which gives you control because he can't turn around and climb on you. Another method, be sure you are buoyant and grab the victim's opposite wrist to pull and turn him. Then, use the knee cradle position and establish buoyancy. The underwater approach is safer for the rescue, but will take a bit longer. It's the best choice if the victim is stronger and/or bigger than you. Descend quickly and approach between knee and ankle depth. Drop the diver's weights if possible, and either swim around him or use his legs to turn him away from you. Ascend into the knee cradle position and inflate the diver's BCD or drop the weights if you couldn't underwater. Once buoyant, a panic diver usually calms down. Reassure and help him like you did the tired diver. If you get caught in a panic diver's grasp, use a release to get away and regain control. The surest release is to descend. Underwater is the last place a panic diver wants to go. Another release is to inflate your own and the victim's BCD. Their volume pushes you apart and establishes buoyancy at the same time. You can also release by pushing the victim up and away from you, then swim out of reach. The best release to use often depends on the circumstances and your size and strength relative to the victim's. If you can't safely control the victim, your only option may be to stay clear until she exhausts herself. Then use the techniques for rescuing an unresponsive diver at the surface that you'll learn a bit later.